Welcome. Welcome to Reclaiming Our Power Health Equity, where we discuss how reforming and transforming healthcare and healthcare systems is not an individual concern, but a collective one. So, we're here today to talk about health equity and what it means for all of us. I'm Jennifer Wells, Director of the Economic Justice Team at Community Change. I'm based in Montgomery, Alabama. Community Change has been clear in our mission to abolish poverty. We know health and poverty are interconnected. When you're poor, it makes you sicker. When you're sicker, it makes you poorer. And since 1968, Community Change with our partners has continued our focus on racial and economic justice. No matter where you live, where your family comes from, you have an opportunity to thrive. This July marked the 59th anniversary of Medicaid, a public insurance option covering health services for millions of low-income people, half of those people being children. And as you will hear in the program, we're not only celebrating the pivotal shift Medicaid has created in public attitude and real access to necessary care, we are also continuing the fight to protect and expand healthcare as a human right that we all deserve. And now I have the pleasure of introducing our moderator and facilitator, Tammy Thomas. Tammy is our organization's economic justice campaign manager. She spent her career focused on leadership development, increasing income equity, and access to healthcare for women in low income communities, especially communities of color. Take it away, Tammy.
Thank you for that introduction, Jennifer, and welcome all of you that are joining us. Thank you so much for taking this time to spend with us. So growing up, I actually relied on Medicaid. My mom was on Medicaid. I was a caregiver for my mother and my great-grandmother, who also relied on Medicaid and Medicare. And if it wasn't for those services, particularly for my mom who had long-term illnesses, there would have been no way for her to access the care that she needed. She had degenerative osteoarthritis, high blood pressure, and some other serious health issues. And Medicaid is what allowed her to get the treatment and services that she needed. So for me, this fight is personal. And I'm curious, do you have a story about Medicaid or Medicare that helped your family access the care you needed? Join the conversation in the comments. Jot it down. We want to hear your stories. It is my pleasure to introduce three incredible forces in the fight for equitable healthcare access. First is the Ohio Organizing Collaborative, with a focus on increasing Medicaid coverage and advocating for doula care under Medicaid. They've been instrumental in securing essential health resources for those who need it most. Their extensive work includes pushing back against systemic changes in healthcare to ensure that pregnant people can make informed decisions about their medical care, and also to ensure that our children in Ohio get the coverage that they need. Please welcome Ohio Organizing Collaborative's Care Economy Organizing Director, Tammy Lunan. And next, we welcome an organization deeply committed to alleviating the burden of medical debt in low-income communities. A testament to their dedication, Central Florida Jobs with Justice just secured $4.5 million for residents in Orange County. $4.5 million, y'all, for those who are struggling under the weight of healthcare costs. They're a part of our Voices for Health Justice project in Florida and are continuously fighting for Medicaid expansion. Let's give a warm welcome to their programs manager, Samuel Delgado. We also want to make sure and note that our partners in Indiana, Hoosier Action, they were not able to join the live recording of this discussion, but their communications and policy director, Tracy Hutchins-Goetz, was generous enough to record her responses for the conversation. They are on the heels of another huge win for Hoosiers in the state of Indiana. They're at the forefront of protecting healthcare coverage for vulnerable communities, particularly those who rely on Medicaid. They have successfully fought back against the attacks on the ACA and Medicaid, and also helping thousands to retain their health insurance. Promoting racial justice in healthcare is truly a model for our path forward that Hoosier Action is paving the way for. Okay, so we have set the table for a healthy serving of leadership and strategic vision. So let's get into the ways we are increasing access to healthcare as part of abolishing poverty. So, Tammy, when I started my organizing, I'm actually from Ohio, and did work years ago around Medicaid expansion. And you are actually currently fighting to expand Medicaid in other ways and make sure more people have coverage, particularly pregnant people and children. Can you tell us a little bit about one, the survey that you recently conducted of 600 Black women about their experiences with the healthcare system? What were some of your key findings?
Sure. Thanks for having me be a part of this conversation. My name is Tammy Lunan, as has already been said, um, and I'm the Care Economy Organizing Director at the OOC, leading the CEO project. We really look at the entire um, care economy here. Like that's really at the core of the work that we're doing. Understanding that stability for families is connected to care, right? If folks are not able to meet their most basic needs, they're going to be more at risk. They're going to be um, more likely to not have access to the things that they need. And so that's the work that we're doing is really centered on that. In terms of our survey, we really wanted to do a little deeper dive into Black women's health. We know Black maternal health has been a leading issue, especially here in Ohio. We have some of the highest infant mortality rates, and also maternal mortality rates. And so we wanted to do a deeper dive into what's happening with Black women's health. So we had a survey, just really collecting information from women across the state. Well, specifically Black women across the state that, have had some type of healthcare experience, right? And people were able to some folks were able to dive deep and talk about um, different things that they've experienced. I think one of the major things that we're finding as we look at the data in the surveys is that a lot of women have had some type of negative experience um, where they felt like they haven't been listened to. And I know that that comes up a lot. Unfortunately, that comes up a lot. I have a story around that, um, where I went into a hospital um, in extreme pain, and they could have done an MRI at that time, like to the emergency room, and that didn't happen. And it delayed the care that I needed by 3 months because they didn't do that MRI up front. And it's just really just goes back to not trusting what's being said, right, and what people are feeling and experiencing. And that was one of the biggest things that came out of it, is that people feel not listened to, right? I think we're gonna dive deeper into what that means. I think there's always this um, unfortunate delay in care that comes up, right? For folks, and we've seen that whether folks have access to healthcare or not, the cost can prevent people from getting the care that they need. And those are some of the things that we want to be able to solve for. So
Yeah. Thank you for that. Two things you said. You shared part of your own story, and we know people are experiencing that all over the country. So I just want to thank you for sharing your part of your story too, and encourage folks, if you have a healthcare story, drop it in the chat. Feel free to reach out to us. And then the other thing you mentioned is just the cost of care. And with that being said, I want to shift over to Central Florida Jobs with Justice, because you all have been hitting the pavement and you know fighting really hard to actually make healthcare more affordable for Floridians. And I'm going to say for us, because although you all just did this, the very first county in the state of Florida, and I live in Florida, I'm waiting for y'all to do this all over the state now. So that's a tall order. That's a tall future order for you. But for you, Sam, tell us a little bit about this huge win that you just recently had.
Gladly. So over the last year, we've been organizing at the county level here in Orange County, where I'm based, to push our county commission to reallocate some of the funds, or rather to allocate in the first place, the funds that were remaining from the American Rescue Plan Act, the federal funds that went to local governments to facilitate fiscal recovery from the pandemic. And so we pushed for them to allocate some of those funds to abolishing medical debt for working class Orange County residents. That would be through a partnership with an organization called Undo Medical Debt that has been doing this work throughout several jurisdictions around the country. And, you know, the opportunity presented itself. And through our partnership with Community Change, we were able to first notify the county that these funds were remaining unallocated. And, you know, it was a little bit of a struggle initially to get them to even acknowledge that. But then once we cleared that hurdle, you know, convincing them to use the funds for this purpose. Worth mentioning within that is that for every dollar invested within the program, because this is a purchase of unpaid debt, they're able to negotiate down the cost of, you know, how much that debt is valued at. And so for every dollar invested, they're able to purchase roughly $100 worth of debt. And so with this investment of $4.5 million, after the overhead costs, you know, the processing and administrative fees that go into that program, the estimate is that this will eliminate over 400 million, roughly $425 million of unpaid medical debt. To get real kind of specific about it, it's for, you know, qualifying recipients of this medical debt relief would be people who are over 400% of the federal poverty guidelines, or whose debt amounts to more than 5% of their annual income. So this is, you know, working class members of our community, residents of Orange County, who are going to qualify for this relief. So, you know, we're real excited to see it finally go through. One of the advantages that we will have is an example of a functioning program in Florida that is helping people to eliminate this barrier to accessing healthcare with, you know, direct examples. And so we'll definitely be bringing that to other jurisdictions throughout the state, and building up community leadership in the process.
Yeah, it's so energizing to celebrate wins after a long road of dedication. Now we're going to hear from Hoosier Action, as they too just celebrated a big win for people in Indiana.
So Hoosier Action was begun in 2017, and before I came on staff, I was actually a member leader. And the very first door knock that I ever went on with the organization, and the very first door knock the organization ever organized, was funded through Community Change. And we, in 2017, knocked on doors and talked to folks about the impact of the Affordable Care Act in their lives. And so quite a lot of those conversations ended up revolving around HIP, or the Healthy Indiana Plan, which is the Medicaid expansion program, which was made possible by the ACA in Indiana. And through those conversations, we became really clear about how central HIP is to Indiana's people and to our economy and to like the health and lives of hundreds of thousands of people across the state. So we talked to a bunch of leaders, found out this information about the program, thanks to Community Change. And then we were prepared when it was announced that Indiana would attempt to implement Medicaid work requirements, which was something that we were really clear immediately was not going to help our people, right? We connected with over 10,000 folks and organized a diverse statewide coalition that included white rural folks, Black church leaders in Indianapolis, the NAACP, and CWA, the Communication Workers of America, and with support from Community Change, staged a big rally in Indianapolis, and we delivered 10,000 postcards and petition signatures to the governor's office, asking that they drop these proposed Medicaid paperwork requirements. They weren't really going to increase workforce participation, but were just going to increase paperwork for individuals and for administrators with the state. We also engaged in a legal advocacy part of this fight as well. They filed a lawsuit with the state that caused the state to decide that they would no longer attempt to implement work requirements. So this was back in 2019. And that original lawsuit is actually the thing that propelled us into victory just last month in July of 2024, because that original lawsuit also included Medicaid power account, which payments, which are like the kind of premiums that are pretty unique to Indiana. And it was one of the biggest barriers to continued healthcare coverage that we would hear about when we were knocking on doors. Because of that, we worked with the attorneys and included all of that stuff in the lawsuit. In 2024, the judge finally ruled on the case, and he ruled in our favor. And it came at this perfect timing because during the pandemic, a lot of the negative barriers to coverage, which I mentioned, like HIP power accounts, those were suspended. And we actually had this incredible 3-year period where I did not hear from almost anyone about problems with Medicaid. The program was finally working in this way for everyday Hoosiers, where in the midst of a global pandemic, for like the first time, all of these HIP members were like, I feel really secure in my healthcare coverage. I can go and get treatment for my anxiety and my depression, which have been exacerbated by the pandemic. I am not worried if I get sick. I can go to the doctor. I can afford it. And so it was pretty transformative. We organized people during the pandemic to make federal public comments, and those federal public comments on the program were cited by the judge in his ruling as one of the justifications for why this policy needed to end.
But we wouldn't have been able to do really any of this without impacted community members and people who are familiar with the issue and who see the need for it in their day-to-day lives. And so we're lucky to be able to bring one of those leaders with us to share their perspective on the campaign. And so I want to invite one of our leaders, Jenna Ferreira, to join us.
Hello, everyone. My name is Dr. Jenna Ferreira. I'm a clinical pharmacist here in Orange County, and I've been in healthcare for over a decade. And considering I do work in the pharmaceutical side of the healthcare industry, watching patients struggle to access care has been a nonstop event for me, unfortunately. And I was tapped into this project through the community building and grassroots organizing of Central Florida Jobs of Justice. And I'm very honored to be here. Thank you.
Thank you for joining us, Jenna. We're so glad that you're here. Jenna, can you tell us a little bit about what this experience has done for you?
So this has been an excellent experience. It's honestly been really rejuvenizing, very hopeful. I work in one of the largest hospitals within the country here in Orange County. that has over 1,200 beds. And I specifically was working in the emergency department setting for a bit of time. And that is kind of seeing patients at their worst. And unfortunately, a lot of the patients I encountered had very serious health events occurring, such as heart attacks or strokes, that in some cases were very preventable had they had access to routine care. So that is very disheartening to see day after day. So to be able to enter into this initiative and actually get a tangible win for the people, specifically my patients, and to see that come to fruition through straight people power. There were no private interests invested in this. This is straight people power. And as Sam mentioned in regards to the debt relief program, this is fighting for money that was intended for us. So my feelings after going through this and getting this win is I feel hopeful that we can achieve more and that we're heading in the right direction of securing healthcare as the basic human right that it is.
Yes, yes. Thank you. Thank you. Now we're going to hear from Who's Your Action, who also just came off of a big win.
One of the things that we know is that work requirements as a policy has a tendency to test really well. It seems to make sense to people. And so we had to do a lot of political education explaining to folks what the actual harm was of such a policy. And before we jumped into those technical descriptions, we had to tap into values first and tap into their belief that everybody deserves healthcare, which is pretty widely felt. And so that's where we would begin. And then we spoke to people about their experiences and then would invite them into kind of a menu of options and a leadership ladder. So for some people, that looked like making a recording in front of their front door about why the ACA matters to them. For other people, it meant sharing their story publicly in an op-ed published in the Washington Post. It was also creating a table of folks where everyone at that table had either been enrolled in Medicaid or a close family member and loved one was enrolled in Medicaid. And that was the team of people who designed our entire campaign rally in July. So we tried to build the biggest tent possible and then also invited in providers to really put those deeply held beliefs into action. In this moment where I think a lot of people felt politicized but powerless during those kind of early years of the Trump administration. That being said, we found that this is an issue that crossed party. People did not want to see their neighbor or themselves lose healthcare, even if they had voted for Donald Trump. So it was really a good way to bridge a bunch of those partisan divides, as well as those racial and geographic divides that really are used to drive people apart in Indiana and justify bad policies. So we were really committed to organizing a base of rural and small town people in places that are pretty majority white and make certain that those folks were in relationship and a self-interested in relationship with Black urban leadership, because those were the two types of people who were getting most hurt by these bad policies. And so building that multiracial cross-geographic coalition was really kind of the secret sauce that enabled us to win this multi-year, multi-stage policy fight.
So all of us at this table are all navigating complicated political landscapes, right? Here in Florida, Who's Your Action in Indiana, Ohio. Not easy places, right? To actually push for big changes. Can you tell us, each of you, can you tell us a little bit about some of the challenges that your team has faced and how did you navigate through it? And what are the strategic bets that some of you are making on your work as you move forward?
Ohio is very tricky because we look to be a red state, but we're actually more purple, but we don't have fair maps. And that really has a huge impact on healthcare benefits, what we're able to win around Medicaid and those kinds of things, because a lot of that happens through our state budget process. And so we have a gerrymandered map, which means that folks don't have fair representation. Um, the other issues that it's very challenging to pass any legislation through the state house. It's a big struggle. Um, and one of the things that we're doing to try to combat that right now is we have fair maps on the ballot in November. We are working to unrig our gerrymandered maps and districts, right? And so I think it presents so many opportunities, but I think that is one of the bigger challenges that we face in fighting on these health equity issues as we look to expand Medicaid, um, implement the doula bill, and do all the other things that families need, right, to be stable and secure and healthy, right? We're hopeful that after November we'll have fair maps, right, and that starts to even out the playing field. It wouldn't be right until 2027, but we get to test it out in 2025, right? So we're really excited about that opportunity. We're really focused in on Black maternal health. We've been champions for the doula bill for many years that finally got its pathway to be included through Medicaid, so families can have access to it through Medicaid. And so we're still working on the implementation of that. And so that's one of those places that we want to continue to dig deep in the next budget. We also want to expand Medicaid for children up to 6 years old. And there's a lot of, like I said, a lot of challenging things with the way our state house is set up. Some of the ways that we're working around it, obviously, is by putting our issue on the ballot, right? Putting it in people's hands. Another thing that we're doing is really building strong coalitions, right? I think all of the issues that we're fighting on, they're like common sense things, right? Common sense solutions to a lot of these issues. If we want to fix poverty, right? We gotta make sure folks have the things that they need, right? And that means access to healthcare, health benefits, access to food, right? There's a clear correlation between health and access, right? And that's where you see the disparities. Um, we were looking through a survey. It was like a data report, and people in Minnesota live 10 years longer than people in Ohio because they have a Democratic legislature and a Democratic governor, right? And their health outcomes are different. So there's a correlation to the politics, right? The politics and the health, right? And we want to make sure that um, we're constantly thinking about that, but we're also thinking about how do we bring our people with us, right? How do we bring our leaders with us to tell that story of what's happening in Ohio?
Yes, yes. Thank you, Tammy. Thank you so much. Sam and Jenna, I'm going to give you all a chance to chime in.
Yeah, absolutely. Thinking of some of the obstacles that we faced in organizing was very similar to one of the principal points that Tammy had pointed out, where we have a radically ideological state legislative and executive branch that has proven themselves to be pretty vindictive towards local governments, not just in punishing behavior that they don't like from elected officials here in Florida at local government levels, but also in undercutting their ability to take action. And so that showed itself in this advocacy around medical debt, where initially a lot of the first pushback we got were questions of, is this legal? Are we going to be allowed to do this? Even if it isn't inherently barred already by state law, is this going to put Orange County in the sights of Tallahassee, knowing that, we already did have a target from the state legislature, rather from, the governor's mansion, where, just last year, they removed our state attorney outside of the powers of Tallahassee. They still did that. And so just recognizing that taking bold action at the local level can have political consequences, was an obstacle that we needed to alleviate in conversation with our local elected officials. Luckily, we were able to show that this is a program that has been successfully implemented in other jurisdictions throughout the country, and being that it is federal funding, we didn't have quite the same obstacles that we might otherwise have. But definitely the fear of retribution from the state was a pretty big obstacle. Another one that I would name, as I had kind of mentioned a little bit earlier, was getting the county to recognize that there was actually funds remaining untouched from the American Rescue Plan, and getting them to open up that conversation to the public, which goes into kind of one of the things we were betting on with this campaign, which was that it would open up a dialogue between our county commissioners, county administration, and the public on the way that the county is using its funds. It created an opening for us to engage in the budget process. That's absolutely something that we want to continue building off of, by really involving our community in the process. The level of power building that occurred was definitely something that we want to continue working through, and using that to acknowledge that we can get the county to do things for the first time, to be trailblazers, even despite the context that we're working through. And I'd love to see if you had any thoughts on that question of like obstacles, Jenna.
Yeah, I definitely agree and have witnessed everything that Sam just named. And another obstacle that I encountered was when having the opportunity to speak with the county commissioners one-on-one to kind of discuss their concerns or questions they had regarding the contract between the county and the entities that will be forgiving and purchasing the debt, was kind of the inner, I want to say, oppressor that remains in some individuals' minds. For example, when it came up of who the debt would be forgiven for, there were concerns of who should qualify in terms of, well, I'd like to see these funds be forgiven for someone's debt who's attempting to pay their existing bills versus people who are not paying, neglecting to pay, kind of rolling into that stereotype that Americans need to pull themselves up by their bootstraps. So as someone who works in healthcare, that was disheartening to hear, disheartening to witness that there's still kind of that discrimination towards working class and poor people. But we were luckily able to minimize those fears and concerns. And as Sam mentioned earlier, the 4.5 million secured will be erasing enough of the medical debt that luckily so far it seems that there won't be a necessity for that process to determine who qualifies for the forgiveness outside the financial requirements. So.
Yes. Thank you, Jenna. One thing I just want to pull this out because you all are doing such dynamic work, but I just want to note, like, these aren't just like one-off campaigns. And Tammy, Central Florida Jobs with Justice is just coming off of a recent win, and you've had some wins over the past couple of years. I just want to make sure we mention them because I heard you touch on them, like you've increased access to the higher poverty level for Medicaid, increasing it to children 0 to 3 and to pregnant women, new moms up to a year. Also in a place that's very hard to move things. And then Central Florida Jobs with Justice, you just had this big win for, what is it, 160,000 people in Orange County? That's huge, right? And part of what I would like to know is, like, I don't see none of this as a one-off thing, like one and done, right? How does this fit into like a larger strategy or something else that you're thinking about that might be bigger down the road?
Yeah, happy to speak a little more to that. The larger strategy really is showing the local government and other levels of government as well that there are other possibilities. There are different things that they can do to improve access and to improve the dynamics that their constituents are working through. I think a good example is, listening to the county commission kind of go back and forth with the leader, the CEO of Undue Medical Debt, when they were questioning her about how the program would work. Was a question of if people had to apply or how the application process worked, and recognizing that there is no application process. It's all the debts are bought outright from the creditor in this case, which would be the hospitals. And there is no like applying that you have to do, which is a good thing because, a lot of times the application process in and of itself is a barrier for relief programs. And so that took a couple rounds of asking around that issue for it to kind of click. And I hone in on that because there are so many problematic practices that we have in the state of Florida with respect to our healthcare system, where, for instance, we haven't expanded Medicaid to meet with 40 other of the states in the union. And that's holding back so much of our potential. And so, when it comes to this program, this gives us an opportunity to agitate around some of those issues with when it comes to access and how we talk about programs that support working class people. So there's that, and then the element of including members of the community in the process of governance. So there's a level of actually just building power at the community level that goes into all of this. So incorporating that radical possibility to the conversation when we're doing advocacy work.
Yes. What about you, Tammy?
Yeah, I think I want to just start first with just naming some of the wins, restating some of the wins. So we worked on a lot of things, but I think some of the most notable wins that we've had around our health equity work. We did win a year of guaranteed postpartum care for those who've given birth to help bring down Black mother and infant mortality rates. We won guaranteed Medicaid treatment for breast cancer and cervical cancer. We won a delay in work requirements to Medicaid. We won funding to reduce lead poisoning that has increased in the budget of the Department of Medicaid and the Department of Health. And in 2023, we won a pathway for doulas to be covered by Medicaid. And I think what happens first is when healthcare is affordable and accessible, when women and families have access to the things that they need, right, they're able to begin to thrive, right? They're able to pursue employment opportunities, further their education, and improve their economic standing, right? And while we have a large vision for the work that we want to do through health equity, we want it to be grounded in that, right? It allows people to thrive. This work allows for folks to actually thrive and get to a place where they can realize their wholeness, as women, as folks that are connected to the care economy, because it's a much bigger framework. If you look at a state like Ohio, we used to be an industrial town, right? It used to be an industrial town, but we've since reverted from that. All of the money that comes into the state of Ohio now comes into Ohio for some type of care. It's either coming in for healthcare, right, childcare, or mental health care, right? And so what we want to make sure is, as we lift up all of these fights around Medicaid expansion, around Black maternal health, around, period poverty, around hunger-free schools, right? Because those are all of the things that we advocate for. As we think about that in a larger framework, it's really about how do we make sure the folks that are connected to care begin to thrive in their own lives, right?
Yes, yes. Thank you. We're going to hear a quick clip from Tracy at Who's Your Action that is also going to talk a little bit about shifting the perspective on the effectiveness of the HIP program that they really pushed to kind of like squash down in Indiana.
As a result of the state's decision to continue contesting this, and there will be continued legal fight, we have been focused on organizing grass tops groups, other organizations in state, and actually just sent out a letter signed by 14 organizations from across Indiana, from folks who work with people who have disabilities, to the American Cancer Society, to the Indiana Community Action Poverty Network. We sent this to FSSA, the state administrator of HIP, as well as the Medicaid Advisory Committee, state legislators, and the federal government to make clear that during the pandemic, everybody had HIP Plus, and the program was cheaper and more effective than having this two-tiered system. And HIP Plus is the default of the program and should remain as such. So we're waiting for some more rulings, but it doesn't mean that our advocacy has ended. And we are looking ahead to the 2025 legislative session, where the budget will be decided, and where they may want to make some statutory changes to HIP to make certain that the program, that these changes to the program are enshrined in law and not just legal precedent. So in the coming months, Hoosier Action is going to be meeting with legislators, convening public events. On September 29th, we will be having a town hall, which we've invited gubernatorial and state legislator candidates to, where we will be uplifting this victory and talking with them and asking them about what they plan to do to continue to protect and improve Medicaid and make certain that the program is administered in a way that is equitable. Because the other thing that I haven't mentioned about power accounts is that they were racist. They disproportionately reduced healthcare coverage for people of color in Indiana. And the state had been aware of this fact through its own reporting for years, and yet was allowing it to continue. And so we don't want to move backwards in terms of these equity improvements, in terms of these improvements to the program. So we're going to be trying to work with candidates and elected officials to uplift the importance of Medicaid to Hoosiers across the state and to our Hoosier economy and our healthcare system.
Earlier, the words power building came up. And Tammy, I keep hearing you say we. And, I'm sitting here like, I know all of you. I know you're organizers. You are community organizers and you're working within the community. But I'm curious, these are things we talked a little bit about how this connects to a broader strategy moving towards something bigger. So Tammy and Sam, can you tell me a little bit? One, I'm curious to know who's the we, and is the we connected to voters? And if it is voters, what does that look like? Are these issues that are actually moving voters?
Yeah. So I would say that we organize are mostly women. It's not limited to women, but we organize childcare providers, we organize parents, and we organize teachers. Right. Within that, there's a lot of other people in there. We organize doulas, and then we have a lot of Black women connected in through the churches. Right, and so we are organizing people that are really impacted by the care economy on all fronts. And I think it's time that we really start to talk about this issue from that lens as a caring economy, right? Because it all reconnects to economic drivers, right? Whether folks have access to these things or not. And so I definitely think these are issues that people care about. Is definitely, I know that our base is particularly fired up for the election. Initially, it was just the redistricting because we understand what's possible. The folks that we've been organizing, we've been taking them through this pathway so that they understand what's possible when we have a state house that isn't rigged, right? That isn't rigged to not work for the people, right? And so because they understand what's possible, like our biggest thing was we got to win redistricting and get our fair maps. I think the election for a lot of reasons has changed. We want to be able to like protect the folks that we think champion the values that we care about. I think our base is like I said, particularly keyed into this election. I think when you pan out, and I'm not even talking about one particular race, but I think one of the things that we have been seeing is that there is a resurgence of folks that believe in democracy, right? And I think that is one of the things that's on the ballot. But then also, I think care is on the ballot. People want to be able to take care of the folks that they love. They want to be able to care for their parents that are aging. They want to be able to care for their children. They want to make sure, everybody has access, to the things that they need to thrive. And there's so many things that connect to health outcomes, right? Because it's not just one issue, right? There's all of these things. We can't fight on every issue, right? But we can connect them through a framework, right, that centers the experience of what our base is experiencing right now. And for us, yeah, care is definitely on the ballot.
Thank you, Tammy. Sam, Jenna, you want to chime in?
Yeah, absolutely. I think that when it comes to who is we, Central Florida Jobs with Justice is a coalition of organizations. Our primary grounding is organizing amongst local labor unions, and so that is the first base that we check in with when we're saying we. It's our unions and our community organizations that make up the coalition that is Central Florida Jobs with Justice. And beyond that, it is our community members, which I would love to hear Jenna kind of speak to the community that came together around this, that has coalesced around the issue of medical debt at the local level here in Orange.
Yeah, definitely. It takes the community coming together to leverage that power. And I was lucky to be in this initiative with everyone affected by healthcare. So I think we kind of forget, like when we think of a healthcare setting, when a hospital comes to mind, we're thinking of like a doctor and a patient, but the effect goes much farther than that. For example, when I am in the emergency room and there is a patient presenting and they are being worked up for a stroke, which is a huge, huge, potentially deadly, very likely to be debilitating event. It's not just the patient going through that negative experience, especially if we are making the consideration that that event could have been preventable in this scenario where a patient just doesn't have access to the care they need. Also, the family member is witnessing that. The nurse is witnessing that. The respiratory therapist, the EVS member cleaning the room, the individual restocking the fluids on the unit. It really, truly, like when trauma is felt in the healthcare setting, it's felt by the entire community. So in this initiative, I was very lucky to be in community with so many different people. So we got to hear from like myself as a medical professional, but also individuals who are patients with chronic conditions who have had to navigate this system, their family members, their support systems, workers who are underinsured. So I really appreciate this initiative because it brought so many different aspects of the working class struggle together in one single scenario. Because not being able to access medical care is indicative of a variety of other systems of oppressions that kind of intersect into one experience.
Yes. So Sam, like it's so exciting. You all are also building an individual base.
This issue really allowed us to directly engage our local government. And that speaks so much to, particularly here in Florida, where there is sort of, there's a lot of energy and political frustration towards the state of Florida's politics at the moment. But this has created an opportunity to talk about what comes out of elections, right? We have so many initiatives at the state level that allow us to directly influence our politics. And so one of those examples, as I mentioned earlier, is the state initiative to get Medicaid expansion onto the ballot. You know, this year, people will be voting as well in the state of Florida on an initiative to allow abortion access as well. And so there's so much contingent on people still focusing on the various levels of government that they have a say in. And through this focus on governance, you know, directly involving people in the process, we get people to see that it is worth engaging around who is on the other side of the table when you're asking for your representatives to take action that can directly benefit you. So we can speak to the concrete and material consequences of elections by saying, like, these are the people who will be deciding on issues that affect your day-to-day life. And so it's definitely something that we can, you know, look back to and build off of when we're talking about, you know, the outcomes of elections.
I just want to encourage folks, if you have a healthcare story, feel free to drop it in the chat. And what's got you fired up about this moment that we're in? We've heard from these orgs on this. What has you fired up? I want to really thank you all for your insightful answers as we wrap up this conversation. I'd like each one of our panelists to give us directions for getting involved. So we know you're doing a lot of things in your communities. If you have anything you want to tell people about that's coming up, I'm gonna give you the time and space to do that right now.
Awesome. Yeah, I think these are conversations that we're going to continue to have, especially especially as we look ahead. To the last points that I just wanted to leave you all with is to remember that when we think about abolishing poverty, it's really about what is good for families, right? And what's good for families is that people are able to work, right? When folks are able to work, they're able to be healthy, they're able to be housed. And I think we have to think about low income people and people of color. The way that we center the work on those folks and their experiences, I think is key to how we continue to move this conversation forward around health equity. I think some of the things that it makes possible once we start to win more transformational changes around health equity, I think some of the things that it will help is that it's going to empower, women to make choices that best suit their personal and professional lives, right? And I know it sounds like so small, but I think as we continue to win, and think about what it actually means to abolish poverty, those are some of the things that it's going to make possible. I think access to quality healthcare is a crucial component to health equity. It's going to ensure that children receive proper care, that they're actually, setting a foundation for them to be healthy and to have a more successful future. So those are my last points. Definitely stay connected. We have a lot of different events coming up. If folks want to engage with us, the best way is through our website, ceoprojectohio.org. And thanks for having me be a part of the conversation.
Thank you, Tammy. Sam and Jenna?
Yeah, definitely, I would say a key way to get involved and stay engaged is to plug in with the local organization, to connect with those people who are, digging through the weeds on local and state policy and finding ways to advocate for working people. There's such a need to remind those who claim to represent us who they work for. But part of that reminder that they get is who's talking to them. And so there are people organizing community members to get out and speak on their own behalf. And so, organizations like Central Florida Jobs with Justice, and I'm sure like OOC as well, and Who's Your Action. I'm sure if you look at our social medias, they're all going to plug you in and tell you about some things that you might not see on your local news every single day. And so, looking up at our social media will keep you plugged in, but also in a very material sense, connecting with local initiatives. We're part of, as I mentioned earlier, the statewide initiative to get Medicaid expansion on the ballot. So if you're in Florida, fill out that petition that FloridaDecidesHealthcare.org, all one word. And I'll also love to share the landing page for our continuing healthcare advocacy here. So check that out. And if you're in Florida, connect with us.
Another thing I just wanted to add is that with this work, I was able to agitate a lot of people in my workplace. I work in a very aggressively anti-union hospital, unfortunately, and getting to share this experience and this win of the medical debt relief, a very tangible win that people can see put into action immediately. It really stirred some conversations at work with working class people about what do we deserve, right? America, unfortunately, has, I would say, propaganda, has kind of brainwashed people into individualism, to not moving in community, not looking out for our neighbors. And this conversation for me particularly has given me a great avenue to agitate at work around workers' rights, patients' rights, healthcare is a right. So just remembering to, yes, definitely tap into an organization, but also talk to the people in your community who you see every day who are on the front lines of these struggles to kind of engage them, point them in the right direction to get formally involved, inspire them that change is possible.
If folks are interested in getting involved because they live in Indiana, they can go to HoosierAction.org/events. And we also are a membership organization. And if anyone is interested in funding our work, you can go to HoosierAction.org/join us to become a monthly dues payer. Whether or not you live in Indiana, we appreciate whatever you can give. It helps us sustain our work over years and to keep these wins present and to keep our state moving forward and in a direction where more and more people have a say in the programs and policies that impact their lives.
Healthcare is a human right, right? Look, I'm going to give 2 snaps for that. Thank you for joining us today and for watching. I want to invite you to continue in these conversations with us. Join us again on September 26th. We're going to have a conversation on sisterhood in health. We'll be discussing with some leaders about organizing and shaping our health for the future. This online conversation will take place again September 26th. Check out these organizations, all 3 of these dope organizations: Central Florida Jobs with Justice, Ohio Organizing Collaborative, and the CEO Project, and Hoosier Action in Indiana. Thank you, and talk to you soon.